Hi everyone, in this video I show you a quick couple photos you might need. This is the numbing cream they put on me. Unfortunately I didn't make no video of the laser how it goes, but they're all same. This is done already. After it looks not bad. It did drip and was really hot in the car, and this I got home. And this is probably same day, a little later. It's getting hotter and burnier and worser every moment. And uh, yeah, so enjoy the video. Most of them details I will explain during the movie. Uh, Same as a yak, but this is much worser and bruder, and the downtime was so long, and I'm still having a dark spotting of all that circles you can see. Hi guys, again me. I went today and did my second treatment on my face. Last time I did yak. This time I did CO2. It hurts as hell. It burns as hell. I see a couple spots. I don't know why they missed it. I didn't expect this mist right here. Also right here, you see the dark spots, and it's mist. And there's a spot need to be touched up. This spot mist right here, this, they have to go over a little bit. Right here, right here. This side is all good. It looks really dark, really burnt out. I don't know if it's supposed to be this way. What I'm doing right now, I was driving like 40 minutes away from there. Then my eyes, I think it's like need to be wiped or something because it's like drooling in my eye. Okay, so I was driving for 40 minutes from the treatment, and my face was all like, you can see this right there. You see the yellow? This is a when you hurt your skin, it start to drooling that yellow thing off first before it heals. So my face was all like drooling a lot. So it was like patted with a regular tissue, and my tissue was like all wet. I have like a bunty and it was all wet. So I have this again, like last time I did. Who didn't see the video, I have 4 tablespoons of white vinegar with distilled water, 1 cup of distilled water, and I put 4.5, so I put a little bit more than a cup in there. And now I have to like pat it, and it's supposed to make it clean. I'm using this reusable, or not reusable, disposable thing. You're supposed to use something like that. So I use this. I'll just pat my face with this white vinegar. So I'm gonna try to wipe my eye because they put so much of this one from the last time, and I have to put it again. I'm doing the same thing for 3 days. I'm gonna put this is half paraffin and petrolatum and paraffin, so it's long-lasting cream. And it's burning, my face is burning on the fire. I did wanna make it burnt like this, I did want it's burnt. I was in a numbing cream and I was like really on the pain. I'm telling you, it was a lot of pain through the numbing cream, and it's still burning. It's still hurting. um, I'm trying my best to stay focused, and it burning. This vinegar make it letting me know how painful it is. It reminds me. Okay, so I'm gonna stop doing this because it's really hurt, like I have and it goes away, pain, but I wish you guys can see how dark and brutal it look, like a bruise right here, because they go over and over and over and over around my eyes. They probably want to really take it. Whew, it's just burning like a, I mean it burnt, so I have a burn. I got burnt. So now I'm supposed to take this. You know, I take a clean glove. My hands is clean, but I will make sure I take a clean glove. So excuse me. Okay, I got me a brand new glove, clean glove, because I don't wanna rub nothing in my brutally burned skin. And I'm gonna use this. I'm gonna put this. It's a jelly-like. Pull it out. There you go. See, it's like jelly-like. But how soon I put in my skin? How soon I put in my skin? It's gonna become. Oh, here you go. It's red, become watery. Like I'll show you. Really jelly. Like you're gonna melt it on my skin because my skin is hot right now. I'm gonna melt it on it, so it feels good. And I'm gonna put everywhere to keep it moist, I guess. Oh yeah, I hope it's gonna go well. I hope it's gonna get well soon. And the point is, they're like, oh, if you don't care about downtime, then we're gonna do our best. I'm like, I don't care about downtime. Yeah, I'm gonna heal like for a year probably now. Why do you say it? You shouldn't say that. Oh gosh. Anyway. And I just did my lip touch up. It's still healing. It was 2 days ago. And yeah, maybe it's too many things in one shot and 1 week, but I'd rather heal once than every week I have a new thing to heal. Okay, so I prefer do it this way than other way, than different way. So I hope you guys understand my point on this part, that do everything in one shot. Like people do surgeries, they do a couple things in the same time because they don't have time to keep coming back and keep healing. It's like a non-stop painful thing. Oh gosh, it feels so good. Kind of. It kind of feels good. Okay, I don't know why would they skip the places. Look at this. Look at this. This skip right here. And here is like how like this. Alright, and that's it for today. I guess I'll see you tomorrow, and well, in real life it look much worse than it is. I mean, it look like I have a bruise, like a bad bruise I have. Yeah, it looks really bad. But anyway, I'll see you tomorrow and we're gonna see what happened. Bye. Good morning. Pass around little over 12 hours. I can see my eye puffed up a little bit, and I contact them back and I see the first side did it really good job. Don't miss the spot. Then here they missed a lot. Right here you can see they missed all that. There's a sun damage right here and it's missed completely. And here there's a half face as missing, as you see the texture of my face. It's not great texture and that must be filled up because it's gonna be right here. Okay, so there will be like need to be filled up to complete the thing, because this is not how it works, at least in my case. I'm gonna contact them and I'm gonna see what they're gonna give me, what day. I cannot wait too long because it will be not possible to when it's crust up, you cannot put a cream on it. It's gonna be like, it's horrible. Oh, they will have to, I will have to come back anyway. So I did, when I did treatment, they didn't have a fan. The fan wasn't working in the laser, so they opened window and it was waving with a regular carton board, and I smell my skin burning, like, I don't know, I guess if I burn alive, I know how I'm gonna smell like. So there you go, experience from the hell. Yeah, really good job on this side, didn't miss the spot. But this spot, cheaters, half a face, cheat up. And this is not the first time. If you saw my video before, you'll see that I got a yak from the same place, yak laser, and they did same. They cheat, and there was one side really, again this side actually, and this side was really light. So okay, I'll come back to you. Oh, by the way, I wake up at night time around 5 in the morning, and it's a few hours away, and I just, it was so, hold on a second, it was so the yellow, it was dripping so bad, it was all wet in here, crossed up, and we see right here still wet, even though I clean with vinegar and water, and it's still there. I'm not trying to scratch it or something, because the skin is, the texture is you can see kind of texture. I always feel every single laser. It was going like slowly, and it's so painful. I mean, if somebody have guts or balls or whatever you call it to go through this to this laser treatment, I mean, thumbs up to you, because it's really, really, really painful. And looks like on the forehead it was painful too, but they go lighter, and you can see they go lighter. They go lower volume. This is cheating. This is not correct. Look how much my skin with dark spots popping up. I'm not pleased completely. And what it take to please person completely? Do your job properly. Since you work in there, do your job properly, correct? Correct. People pay you for it. It's not a free procedure. It's expensive as hell. Okay, I'll see you soon. Probably tonight. Have a good day. Okay, hi guys. This is not a late evening, but I went back and fill up that missing spots, and also around my lip and under, and right here it was missing, and right here above the eyebrows, and whatever they see missed it, they filled up. Most of them places. Okay, this time I don't know if it's filled up here or not. Maybe not. It doesn't even get red. So this time when I went there, and because non-numbing cream they're using it from one jar, and they have just a little stick, and they keep double dipping with that stick on everybody's faces. So they didn't numb me this time, so I don't get no infection or bacteria or anything like this. So this time they just put a cold freezing air on me and on the spot, and then they just go with it. And I mean, I like that patch on my nose. I will be like a reindeer, I guess. I hope not. I'm not. I'm trying not to be a reindeer or any of those. I just try to be consistent, and I don't want to have little. You see, little of my skin come out. And I mean, here it's not that bad, but most part was right here. It was very, very strong, like a large pores. And I have a sun damage. You can see right here there is still have a little bit of sun damage right here, but I guess I'm gonna deal with it later. I'm not going back. It's every trip was 30 miles back and forth, and now they go over a little bit up right there on my neck, you can see. And yeah, okay, let's see what happened. This is for my lips, and here it was I just did it like an hour ago, and for the rest of them it's from yesterday, so it's not 24-hour yet, but it's almost there, around 20 hours pass. Okay, and see you tonight. No, tomorrow morning. Bye. Hi guys, this is morning of next day. Oh, I was worried this morning because of this. When I wake up, this all the moisturizer was gone overnight, so it was dry, and right here it was that yellow
I don't know how to pass, whatever. The yellow things dripping to heal. You know when you cut your finger and it drips out the yellow thing out first to seal uh, your damage, and then it's gonna make it crossed. And okay, so it was crossed up right here. It was dripping a lot of yellow thing right in this area because it's more damaged than probably make a laser too, they push it too hard to my skin, like press it in, and that's what make it laser closer, and they burn a little bit my skin. See, it's burn. And I was worried about, because it was crossed up, and I was worried about that it might have infection or something. And I texted and called the lady, and she came to me. Okay, I give her address, and she came to me. Also in the nose, when I do that vinegar and distilled water and pat it, and probably I just moved it or something, and it's, you see, the nose was again in the machine. There was circle like this, and I put machine in there like this, so nose was too close to the laser, and it burns too a little bit. I hope it's gonna heal. I'm not gonna touch it no more, because look, like I strip some skin off my nose. You can see now it's gonna take a longer to heal it. Yeah, same as here. It's not infection, it's a burn. She say it's fine, and she been so nice to me. And she bring me this Neosporin. Yeah, she bring me this so I can I just put it on, and she say wait like 10-15 minutes and then apply this one back. So this one, pain inch scar ointment. So she said they have a little bit antibiotic in there or something. That's what she say. I hope it's true. Really nice lady, really nice. She's a Persian, and I think there is a couple people Persian in there. And she's really nice. She gave her own cell phone, and she, when I came back, you see, she was trying to fill it up, missing spots. I appreciate that. And they have a missing spots, and I showed her, and she's like, oh, I think we went there. I said there is no laser print on it, so it really we didn't go over, and you can see dark sunspots right here. So it's here under it too, but we don't go under. So but above you can see there is a some damage spots right here. I would like to go over it, and here too, over the scar you can see. So she said let's see, right here too dark, you see dark spots. So she said let's see when it's healed, how it's healed. Here's this part missing too. We'll see what happened here and how it's healed, and we're gonna see, maybe we're gonna fix it. Yeah, I also ask not to go over my lip since it's fresh tattoo, and it did a little bit go over right here somewhere. Just a little corner right here somewhere. They just barely touched it. I hope nothing gonna happen to it, and I hope my nose will heal. I'm not gonna pat it no more with the vinegar. I mean, it's a good thing, but I think I'm just peeling and damaging more. It's a really, really soft skin in there. And here, hopefully it's gonna go away. Whew, that's it for right now. My eyes puffed horribly this morning. I was feel as soon as I wake up, I like my eye like closed, and I'm like, okay, I know there's probably puffed up eye. You can see how much is like water inside. Probably need to stay away from the salt and all this stuff to less water in your body, or I don't know. Okay, so that's what it is right now. You can see the texture of the laser. They didn't did like circles in under it. I wish they did all like that, like all my face. You see how nice and clear. Then the circles, missing spots. Okay. Anyway, I just wish the best and see what happened. I'll see you tonight. Yeah? Or tomorrow morning. I'll let you know it's tonight or tomorrow morning. Okay. Bye.
I think this robe, very nice camouflage for my red face. It looks not that bad with this red robe on me, but it does burning and it does hurt. Just a few pictures
Like I promise you,
between my
evening.
videos.
While still swallow. I know the oh, you can see very well right here how swallow it is. All of it, all around. Very watery. So what I do, I'll take a little cloth and little cloth like this, and I pour water. Glove. Oh my god, this glove is like a rock. It really plastic hard. Wow. Oh my goodness, they're really hard. It's like soft here, but here it's hard, really hard. Like sounds like it's gonna break in a minute. Okay, I'm gonna get a fresh one, just you know, on the safe side. Hold on. Okay, I just got me a fresh one, clean, and I'm gonna put this first. This one, Pain Each Scar Ointment, which one supposed to help with the scarring, if so, and I mean it should be good. So what I do, I take this, it looks like that, and I'm gonna put it on my glove, and I'm gonna put on my nose, of course, because it smells funny. Smell like kind of like maple syrup. Is that funny? It smells like maple syrup? Kind of. Or maybe they like that. Yeah, like maple syrup. Honey and maple syrup mixed. I don't know. Have that special smell. So I don't need to put everywhere, but on this the most burned places, which one I wanna, because it says right here 24 hour infection protection. It says right here, you see. Okay, so if there is anything infection gonna cut to these places, I would like to prevent, especially my nose. crusting up slowly, so I'm not gonna rub or touch this nose anymore because I'm scared to make worse. I put a little bit just everywhere. Things on it. And then I'm gonna continue with this one, okay? Then I'm gonna add a little bit those. What I did to my bed, my pillow, how to say, my pillow is, I put a older towel or any towel around my pillow. I just rub it around the pillow, and I wear some older pillowcase, because all this stuff, yellow stuff from your face, it was just leaking and dripping all night long. Whenever I touched it, it was wet. Okay, my face was all wet, and that's what crossed up with this stuff. All yellow, dripping and dripping all night. So if you wanna protect your pillows, please rub it inside of towel, older towels, and don't lay on the towel because it's rough and it might scratch your face. So put on top any pillowcase so your face feel okay, and you're not gonna, because you're gonna drooling and dripping in the case, and it will dripping through the case, and you're gonna ruin your pillow. So you will have to wash your pillow, complete pillow. If you don't want to do that, wrap it in a towel and you're gonna be okay. So do this, and I'll see you tomorrow and see how the progress goes. Okay, good night. Let's go to the third day. Hopefully it's gonna be good. Bye. Good morning. Day 3 today. Looks like start to kind of crossing up and peel right here, as you can see. Right here a little bit. I can feel right here a little peel. Still red. And healing and peeling. I do not rub in my nose no more. Hopefully just go away. And what I did this morning, because it was so dry, it's still dry right now, so I'm gonna put more so she can see the texture. See missing spot, the text. Oh, it's okay. I don't know. Alright, so yeah, you see this peels a little bit. Crumbs, crumbing. This is don't look white no more. It's gonna peel too. So I'm just gonna reapply a little bit of I'm gonna use my glove to reapply more greasy stuff, keep it moist. I don't know why. I know why I'm keeping it moist, because it's tightened up my skin too much. My puffy eye was really puffy today. Day 3 puffy, and day 2 for my fill-ups right here, and the fill-ups over here. This is day 2 for them, and day 3 for rest on big circles. Okay, so I'm reapplying. I'm putting more this greasy stuff. I'm so tired of the grease on my face. I don't usually wear makeup, and when I wear makeup, it looks really nice to short time period, because then it's look really ugly like an old lady. And that's why I did this, because my skin look like I'm an old lady with a bunch of makeup on it. I don't like it, so that's why I go through this. For this specific reason, I want to improve my texture of my face We'll see how it works. But this grease, it just kills me. I don't like grease on my face. I don't like my face is my skin is T-zone, greasy on the T-zone, and oily, I mean. So try to find the right word to say. Okay, so I did all this. They did punctuate my lip tattoo a little bit right here somewhere, because they go like a corner, and the corner grab over here a little my tattoo. I hope it's gonna peel, because it hurts. I hope it's not gonna affect my tattoo, because I just freshly did it, and I asked them specifically, please do not go over my tattoo, and they did like because it was like you can see like it was squarey. This is squarey. It wasn't like a circle. This time they changed the shape for square. Like right here is a square, and right here is square. On the nose, this square. So this square kind of sideways or so. In the corner of the square got a little piece of my tattoo right here, so you can see. So this is another thing you can see what happened if it's got on your tattoo, or what might happen to your tattoo if you have a lip tattooing. So the good thing about the lady, she is she doing a tattoo. She's the permanent makeup artist, and she say if something happens, she will fix it. That lady is awesome. Like, I never met the person who gonna, you know, first I tell her there's a missing spot. She like, okay, here we go. Next day she will come here, we fix it for you. So I come back, then I say, I'm concerned to my this part, and I she give me her cell phone. I send her a picture, and she came to my house, which was 16 miles from where she works, and she bring this cream for me for free. Then she say she will fix my tattoo if I want to. Like, this is so amazing. I mean, not very often you meet the people like that who will like take 100% in you, and will try to make you happy no matter what. The other downsider, even though I go in the shower and I wash my hair, this grease stuff is just gets in my hair. And my hair, even though they're not dirty, I just washed them yesterday morning, okay, yesterday morning. And this grease is just because my hands are greasy and they get on my hair. I mean, I don't know, maybe it's a good thing about it, but my hairs look so greasy. They're not dirty. I washing them on a normal second day basis, but because of the grease all over me, I am sure it's gonna take a little while when I get off that. I'm wondering how this patch gonna go away because it's really patchy on my nose. We'll see. And I'll see you tonight. This is day 3. Okay, bye.
I think my time is up.
This is on a light.
Make sure you tell that Randy
So you guys
all
can
about
see
me, just the good stuff though. I will, Pop. Son,
is it improve
you're gonna be a great father.
skin texture
No.
or not. It's very
itchy.
Is that you? The portal to the netherworld has been established. It's only a matter of time before the
Started
dark
peeling
ones
right
break
here.
free. Well, we gotta find it and destroy
You
it
can
before they have a
see
chance to escape. The knights must be the
it
ones
peels a little
responsible
bit.
for the rift. Those numbskulls are still
This
around.
is
One
peels.
of them has made contact with the prophesied one. How can I find this knight? Where was the book first unleashed in these times? The cap. Let me help you. If the Dark Ones learn I've been talking to you, they will swallow my soul. You owe me this. Free me, and I'll stand with you again.
I'll free you when I find a suitable host. And once the prophesied one is killed at the hands of his own offspring, we'll have so much power the Dark Ones won't be able to stop us.
Oh, fuck! See what drugs you can find, like some painkillers.
You see my puffy eyes? They're really puffy. You can see from here, from this corner, how puffy they are.
Holy fuck!
Come here, Kelly. Give me a kiss.
Yeah.
My scar on my forehead. I don't know if it's gonna improve or not.
Hey. You with me, Nightball?
Okay, it's still right now it's exactly three days since it's stopped. I mean, since I did it, 3 days exactly, and I want to show you my face is peeling. Look, all this. I keep it greasy and stuff, and when I move it, you see all this is peeling away. Thin layer, but it's peeling away. So I'm not rubbing it, I'm just like when I move it, you can see it's just, see, a little layer just coming out. I don't want to rub too much, but yeah, all this, look, it's gonna come out. Nice. Everything is coming out slowly, because I saw some videos of CO2 laser and you guys skipping this moment, and after shower something is just all gone already, and you don't see the how it does. So 3 days exactly. By the time, okay, this is all peeling. It sounds like I can just peel it off, but I don't want it. This one did 2 days ago, okay? This one, it got 2 days ago. So tomorrow we're gonna peel probably like just like this. And this is 2 days ago right here. So so the texture of the face, is it improve? I mean, do you see right here texture? Thick and like a big pores, or right here. Right here, when they missed it, they have big pores. Right here, you can see pores, and here is a more smoother, just a redness. You can see the difference between these pores right here with the yellow. See, you can see like big pores, and here is a smoother kind of. It will be smoother, it should be.
I mean, extreme burn should be smoother. Okay, here is a peeling. This was much lighter, less aggressive was, but I should improve a little bit. Okay, so I'm gonna take a shower. I let it peel through the day, and at night I will take a shower and wash my face with a soap this time, and I'll show you what's happened. Okay, look, see, removing all. Okay, that's how it peels. Okay. Whew. It looks disgusting, especially over here. Very disgusting. Not pretty at all. Ew. Okay, see you soon. Good morning. Last night it was late, but I did what I say. I took a shower, and I wish we was go a little higher on here with laser, and here a little higher, just a little bit. Hopefully it's gonna go away. Maybe not. And you can see the missing spots. So I'm still gonna peel. This is gonna peel this dark. Okay. This is gonna peel a couple pieces. This is gonna peel. It's not peeled yet. It's like one day to go. Looks like then less damage they did, then longer it takes to peel. See how slow it peels? Just a little bit right here. And this is a less damage. This was severe damage, and it peels much faster. I like the skin texture. You can see the difference of the skin texture between here, a little piece, you see, like a pores. You can see still pores right here, right there, and right here. So much smoother compared what it was. Let's see this. This lip is go over. You see this corner little? It's go over the, you see the little thing right here, like a little scar on my lip. Yeah, that's what they go over my lip a little bit. My nose, my burnt nose, still healing. I don't want to peel. I don't do nothing to it. All I did yesterday is, you saw it's falling apart already when I just touched it, and it was falling apart. The big chunks right here was. So what I did, I just take my bottle with a vinegar to the shower, and I start my shower, start patting with a wet vinegary little towel with vinegar. Just pat it, and then like this gently just touched it, and all that little rolls go away. My eyes still puffed. Hopefully it's gonna go away. I don't know what to do with them. Hopefully it just go away soon. Shouldn't be like this. It's too puffy for me. Everything else, I do love the texture of my skin. It looks much fresher and younger. It's like a baby skin almost. I didn't have that nice mean, maybe I like more pink than you know, sun damaged. So but this circles on this side, as you see, then less than make sure if you go there, make sure, ask them, do not miss the spot. Make sure they go all of it through your skin, and tell them do not miss a spot, because otherwise it's gonna look like this circles, and you can see the skin missing and spot missing, and then you have to go again. If you go again next day like I did, they're not gonna numb it. You have to deal with that laser, and just they put maybe icy cold air condition the air. So this morning it was like, so like I wake up by like scratching this side, like it was so itchy, and the skin was flaking, so it was like dry and itchy, kind of like really want to scratch it. And I did scratch a little bit, then I understand that I shouldn't do that, so I stopped, and I put right away this itchy cream. I think it helps, actually, it stopped itching. But most of the time when it was itching, and especially my cheeks always itching, I was like, I want to just rip it off. And it's like I did like this, I just stretch my skin back and forth, and it helps. I mean, forehead, you can't do much. It doesn't itch on the forehead. And also I have this scarring, which one it was a bad accident a long time ago. I want to update quick while I'm doing this. If you guys watching my videos or interested, whoever, I did the 2 laser removal. I still have a little bit left right here. You can see, maybe I'm gonna just cover right here and make a stub it couple times for this tattoo go away. Just couple lines or something left, maybe on this side, maybe not. Okay, so I want to see, is it improve on my scarring? Who knows, I don't know. It's still, no, I mean, maybe a little bit, because the skin will be thinner around the scar or above the scar. I don't think they get right here. You can see there is a circle right here. There is nothing. They don't get this part right here. They don't get this scar, and they definitely don't get right here. It's not red. It was never red. So same thing here. They was trying to, but okay. Anyway, so I would say, this one I need to fix right here. You can see, maybe go like a line right here. Gonna be again puffy eyes and all this stuff right here. I have to go there, and right here. Let's just, they ask for it does healed completely, because here's a half nose wasn't even touched right here, and right here wasn't touched even. They did burn my nose because they put the laser right like this. You know, you can see. Usually it's touched the skin flat and go right there, but my nose was way inside, and they burn it a little bit. Hopefully it's gonna heal it. Everything else is good, just waiting for this probably pink to go away. And don't forget, this is only yesterday was 3 days. It's not even, it's like 3.5 days pass. 3.5 days pass for main, and 2.5 days for this one. Is still, you can see texture. It's not peeled yet at all. It's still, because it's a thinner layer. See texture, it's gonna peel. It's not my skin, it's a laser texture. So the skin is right here. It looks much better. And here's the laser texture. Is gonna peel right here. It's gonna, hopefully it's gonna be lighter and prettier. And on the, like, here's a little piece between this laser. Let's see this square right here, and right here there's a little spot missing. So right here nothing happened either. So I mean, we'll see in the end what happened, because this is a really rough and brutal process. It really hurts. Without numbing cream, it's really hurts. So there you go. I will keep updating you until this puffiness go away, maybe pinkness go away. Totally, completely healed my nose and my chin, and update on my lip tattoo. What's gonna happen to it? Is it? Yeah, I think the color might be missing. You see how purple it is here? I think they just take a color off. I don't know. We'll see. Okay, I cannot say nothing until I see something. Okay. And I update you tonight. Is it any changes, any betters, and I'm gonna find out if I actually able to wear my makeup. But most of makeup, like, that's the point. I don't like to wear it. My eyes puffy, it doesn't look nice. My nose is still crunchy, and the skin very thick here. It doesn't gonna look good any makeup. So maybe I will just wait until they're totally completely peeled off, so it's smooth skin at least, and my puffiness go away, because I don't think it just tied my skin, and my eyes wasn't like this puffy, is it? Okay, I'll see you tonight. Bye. Guys, I want to update my laser video. Sorry, I skipped few days because basically I show you the most of peeling, and today is the second day of after 1 week. So it passed week plus 2 days. The redness still there. You can see it's going away slowly but surely. The puffiness go away, most of them, by evenings. This is morning time, and I put a lot of moisturizer because the skin's still dry. On a touch after every wash, it's dry. My nose almost healed. It's still healing. It's still crust in here, kind of, because they burn good. This cheek, I'm the most like it because there is a less missing spots, but still you can see the puffiness right here. It's because of morning. By evening it's gonna go away. Also my forehead, I wish I don't see no much peeling going. Maybe it will, who knows, but it's kind of dark, on the dark side, and you can see right here how it was. So I wish it was more stronger laser go above on top of my forehead than a light, which one doesn't get much. You see, I need a really strong go with my very aggressive laser should be to get off. This is a dark spot where they missed, and they go light above and nothing happened, as you see. Yeah, my skin need to aggressive laser. The light not working much. The darkness on my nose, even though they go right here over it, I can still see dark spots. It's all peeled off already. Obviously it's still dark around my eyes. I'm gonna go back in a few days. They say I need to take at least 10 days or so to just able to put numbing cream. Actually, I wear makeup yesterday. Some pictures was great and some pictures was not, because of the hair skin was really puffy and too much, like, you know, wrinkles. So I had a laugh one morning when I got my kids to school. I say, how you like my baby skin? And my daughter say, because my ass was so puffy in the morning, and she say, Mom, you look like an old lady with a baby skin. I like, thank you for honesty. So I love the texture. I think it's improved a lot, because if you can see right here, close to my eye, there's still texture rough, like kind of have like a thick pores texture. And here is a little smooth up the texture. Nobody say it's gonna be always like this. Maybe it's roughen up a little bit later, but the results is awesome if the tech or person who doing it right, and don't cheat, don't go, because when you got there, even second time I went there to fill it up, because you remember he was nothing in here, he just left everything like rough texture here, nothing right here. It's still nothing right here. Did like they said it touched, but it didn't. Then is it still white in here? They didn't go over my scar. So so what's the point is, if you come there and say, make sure there is no piece between, don't care what's the shape, circle or a square, they have triangles, whatever, how long as it's one to another and no missing pieces, like most of them here, it looks nice in one pink piece. Here you can see patches, you can see square circles. I mean, this is not, look, the dark spot right here, dark here, it's all missing. My cheek should be all peeled off, and under eyes, make sure it's got, like, maybe they need to pull a little bit and go like where you need it. They can mark it. It doesn't matter to me, like I just telling you, because when you get there and do this, and it's so, you in fire. When they did on my cheek, I was like a soldier. I like, just get rid of that darkness, get rid of that darkness, and I'm just going with that pain every time they do it. And then when they finish that cheek, it's like just like your heart beating. It's so hot, it's so like, feels like your skin just peeled off and you have open wound, and it's like you feel your heart on your cheek, how beaten up, like, you know, like so it's really painful, and it's not for people who have a high tolerance of the pain. It's like really, maybe you have to prepare yourself, maybe take some I don't know, medications, or I don't know, but be really aware. It's really painful, and it's not for people who want to just a light up thing. It's really brutal. It hurts all day. I was sitting in traffic, especially if you're California like me, and it's really sunny. You have to make sure you stay away from sun, you stay away from outside, even outside. I mean, first 2 days at least, because you're gonna be really red. You saw my videos. So what can I say? The second time I came to fix it, make sure you don't need to come a second time, because next day I come, it was horrible. They couldn't put no numbing cream because they don't want to infect the open room in mine, and they did on just a cold air and same laser. That's why they go light, because it will be so, it was still painful, a lot of painful. And when they finished, I said, are you done? Are you did all of them? And they're like, yeah, everything is done, everything done, we got everything. And it's so painful, you just want to like run away, okay, bye, and want to go home and just you know, go with it. And because it's really painful. So make sure it's done one time and one time only, and everything cat on. Just take all your powers and willingness to hold and do it. Make sure there is a good quality, and make sure there's nothing you say, I don't want to come back ever again. Not in the first 6 months. Please don't miss nothing. I don't want to miss in spots, nothing. Make sure you get everything. If you have a dark skin like mine, you can see between my hair skin white and damaged skin, all this darkness, it's just like a big mask. So do it, do that. And maybe I'll make one more video when it's already everything go away, or I'll come back when I do my eyes, because they say they're gonna go over my eyes and take this missing darkness, and we're gonna continue my journey with my face. I'll see you soon. Bye. Guys, today is gonna be a week and a half after my CO2. I didn't fix the eyes yet. I put a cream here. The skin is kind of like a sandpapery. I think that it's still in a healing process, because it's kind of like dry and not really smooth. It's not like the smooth like my old skin. It's kind of smooth. It's more rough, like a, you know, like when you have a picture glazed, and the other picture is going to be matte, which one like this, like like a picture, I don't know, it's not shiny at all. See, and the pores is minimized because probably it's like the top layer is gone, but it's kind of texture really just like that picture, just much more thicker, rougher, more rough. Yeah, maybe still have to heal or smoothen up, or I don't know, but I put in the lotions and creams every day, washing, and I think maybe it's need to be exfoliate gently, in a gentle way. So I'm using my brush, but I'm not turning on a high speed, just in a low speed when it goes slowly, or I do it myself slowly. So I'm exfoliate this way, and I put a lot of lotion, a lot of cream, a lot of making really so the redness, as you can see, it's blending in with my skin, with my color, so it's not that bad. Yeah, my nose still a little pink because I'm probably still healing. What can I say? My forehead, I can see the dark spots still there, as we talked about. I say last time, I can see the circle right here. Really clearly you can see circle, the laser. Also, I'm not sure, but I got this Sephora powder, transparent powder for sunscreen. It's 45, and I'm not sure if this powder, I mean, you know, it just logically doesn't set up on me that powder can give you 45 protection from the sun. So I will suggest to use for no hyperpigmentation, suggest to use a regular sunscreen. There is a new sunscreen. I'll show you 1 second. Okay, this is the one I was been using it, and it's almost finished, but it says ultra sheer dry touch. It's true, it's ultra sheer dry touch. Disgusting on if you get in your mouth or lips. It tastes disgusting. I cannot stand it. But also stay away from your eyes. It may irritate your eyes, possible, depends of your sensitivity. and I see the new one, same one like that, but it's new one, and it's I think it's 100 plus ultra sheer iso spray for a body, but I didn't see for like this one, and I don't know, maybe I can use that spray on face too, but I might try it. I just not really happy with the taste of it, and afterwards you need to wash it off anyway. Yeah, every 2 hours reapply, as every sunscreen it says. That powder is, it's cool when you little sweat or something, you just can take a shine away, plus it's a sunscreen kind of, but I mean, maybe it is. I'm not a professor or about this technology of the sunblock, but this one is, I believe it does work. It's just texture or thickness of it, or I put too thick, I have no idea, but when I put it, I feel like it does protecting, but I don't think it's enough moisture gives you. You have to moisturize your face so much and drink a lot of water, and then put this, and then maybe wash it every 2 hours and reapply it, maybe this way. But I believe this is better if you're really scared of get a sunburn or something and you work on the sun or something. Stay away from the powders. I don't know, it's just not logically protecting me in my mind that just a powder can get the 45 sunblock, and I think this one will be the best solution, kind of, or maybe they have a better even than this one, and I actually looking for it, and if I found it, I'll let you know. Okay, and I'll see you later. I'm still try to fix my darkness right here and around the eyes, as you see they missed it, and you cannot see much, it's not that bad, but I know they missed it, and you can actually see the brown spots right here, and it would be nice if it's gonna be one color all the face. Important to not overdo it. This is another thing, but anyway, I'll see you soon. Bye. Good morning. Today is last update of my CO2 laser treatment. I did it 2 months and 1 week pass. So this is what it looked like. Also, I did notice the darkness get darker than it was, but it was like different darkness, and from laser treatment center they told me that I need to use bleaching system, because I like why there my face get darker after treatment. So my skin get darker and I couldn't figure out why. I thought it's my genetic hyperpigmentation, but laser center the nurse say that I need to use brightening system, which one gonna make my face lighter, and I have to use right away after 10 days. I missed that information, and because I basically everything I know I already told you in the first videos of this journey of my face, and I wanna say the texture is really nice. I didn't go for this where the pieces, well, the missed spots right here. I didn't go back yet. I do have a appointment for next week with and see that darkness still there because YAG and CO2 laser, even though they give me like a big break between these two laser treatments, like almost like 5 months or something, or 4 months, and right in 1 month later after YAG, because it was so light for my, like, I understand it was too light for me, so I came right after 1 month and asked them to do the second one and CO2 instead of YAG. Also, they go over my lip and you can see, okay, it's right here on this side, this corner right here. They go over it, and my lip tattooing a little bit off. Not too bad, but like if you know it's there, but it's not bad. So my eyebrows still have a little bit tattoo in here, and my eye hair, I used to have a much thicker, but I damaged it, plus my scarring ruined this eyebrow, so it doesn't completely grow right like here. And so it grows back. The over scar, it might be softened up a little bit, but scar, it's not easy, especially deep scar like that. You cannot do anything. It's not a scratch. My forehead was open completely and it's not gonna dissolve by the laser. So on this side it was so dark actually, and the brightening system picture which one I should use, and it's like way very expensive. And I'm looking at the box and it says they have a pads, they have a cleanser, they have a whole system, okay? And in the end they do have whitening, brightening cream or something. So what I did, instead of pay over $200 for that system, it's like not a big box ever even, and I went to Ulta and purchased this, and I think, I don't know how they do that like that. There you go. I purchased this one, and they say this is a best they can recommend for dark spot corrector or sun damage, or, and it came in like this little. I used 2 times. Oh no, wait, 3 days, and that's like half, a little more than half. I used it, less than half. I used it less than half, and it's a itty bitty. It's around 20 bucks or 19 something, and this is yeah, 0.33 ounce, 10 milligram. And I went to Sephora, and Sephora, out of focus, okay. And Sephora don't have this size. They try to sell it, which one is like 3 times, and it costs 75 basically. So around same price. It's just they don't. So I just want to say there is a possible you can try first if it's work for your face or something. I did 3 times. I feel little brightening. I don't expect crazy dramatic. I just don't want this darkness. And right now I don't have nothing. I have no makeup. I just wash my face with the turning brush I have. So it's fully And so this is a nighttime. You put in the nighttime, and make sure you're wearing a sunscreen in the morning after you wash your face. You wash this off. You put your moisturizer. You put sunscreen and protect your face. Anyway, even in the shade, you want to protect with some kind of SPF. So so with all that says, I kind of like a result because I like to minimize the pores, and my face look much smoother than it was really. Like right here you can see still that's how deep pores I had, and it's not so pretty, but it got much better after laser. So main idea of the laser, it's brightening the spots. You have to brightening your spots, texture of the face, tightening, maybe a little bit younger look is gonna be a perfect. CO2 is bomb. I like it. I do love it much better than yak. Yak was like between CO2 and clear and brilliant in laser way. Laser way, not for me. I'm sorry. I don't know. I know most of people love the laser way, and they like, oh, it's the best, or it's this because it's gentle. It doesn't do much. You have a red face first day, and then you just whatever. It's not for me. I like to go brutal. I like to go, because you know, age, talking about the age popping up of my pores, and I need to slide it fast and without you know, surgical or a knife or scalp in my face. And I wish it was you know, maybe a little bit less brutal, like close to the yak, but still brutal, because I just probably not lucky enough to have everything slide you know, smooth and how I want to. Maybe I'm too picky. You're picky. Maybe I'm too picky. Maybe I'm just know what I want for myself, and I know they can do it without overdoing it. And I'm just, you know, wish you guys luck, and this is it. I'm gonna go, I don't know what they try to offer me more to. There is not much to fix. I think I just need to go with it. I don't like darkness of my forehead, but if they want to go over my scar again, because they skip right here, they didn't even do it. So if they want to go over my scar and smooth a little bit my scar, will be nice. And maybe they're gonna go a little bit right here, but I don't know. I don't want to again puffy eyes for 3-4 days. It's not pretty. It's not pretty. And when you do that and you put everything on that list to cancel everything you got, you push your plans away, you put your children off, you know, do not go out, do not be in the sun, do not. And that's what I'm saying. So make sure you have a good tech who doing this, laser tech, or how you call it. Good luck, and do it. Don't be scared. Don't be scared. Life is scarier than that. Okay, have a great day, and please put a lot of likes if you like it, and so I can do more videos like this. Sorry it's taking me that long, but I really wanna you see the final result. Skincare very important. Hydrate your face morning and evening, wash well, live your life and enjoy. Goodbye. Bye.